Well, thanks for staying with us on the program this morning as we look to commemorate the World Tuberculosis Day. Bringing it back home is also on Nigeria's burden. Nigeria has a co-burden of tuberculosis and HIV. And a lot of eyebrows were raised when conversations on the withdrawal of US aid from Nigeria following a new policy by President Donald Trump started. But in keeping with Nigeria's efforts whilst dealing with the challenges of tuberculosis, we have Dr. Urhioke Ochuko in the studios this morning to tell us how far Nigeria is going and also commemorating this year's observance. Doctor, good morning to you.
Good morning. Thank you for the opportunity to be here this morning.
Well, you're welcome once again, Doctor. First things first, let's delve into the matter. Tuberculosis is one disease that has claimed quite a number of lives and continues to do so on a yearly basis. Nigeria has its own large figures of tuberculosis-related deaths. But from your perspective, as someone who has worked closely, with patients of tuberculosis and someone who advocates for the eradication of TB in the country, how much of a health burden is this disease?
Okay, thank you. So, we may already know, Nigeria is sixth globally in terms of the number of countries that have a high burden of tuberculosis. Amongst the 30 high TB burden countries, we are ranked sixth, and we are first in Africa. With a tuberculosis incidence of 219 per 100,000 population, and that translated to 499,000 Nigerians with tuberculosis for the year 2023.
Fresh cases
of tuberculosis for the year 2023. But
that's a very alarming figure, Doctor.
It is. But with the combined efforts of the government, partners, and other stakeholders, I think we're making good progress, because for that same year, we're able to achieve over 370,000 TB cases that were notified, and that came down to what I'll say about 80% achievement, which we think is significant considering previous years when we were struggling with barely 100,000 Nigerians placed on treatment annually, way back 2018, 17, thereabouts. But from 2019, 2020 up to even 2024, we've made steady progress in our response.
Well, let's talk about the issue of access to proper health care and proper treatment for tuberculosis in Nigeria. With the advocacy that you do, and I believe with the tremendous work that other medical personnel also do you think that the efforts being put in are at par with the huge burden of TB in the country?
Yes, I'll say yes. The efforts are at par, because if not for the efforts of all stakeholders, the government, the partners, some line ministries that are equally supporting in their own regard, members of the press, we're steadily seeing progress, and the numbers are making us to believe that yes, the efforts are really yielding good fruits in terms of our notification as well as other aspects of the TB response in Nigeria.
Now, many people will be wondering what demographic in terms of age are most susceptible to contracting tuberculosis. When we hear of TB, it's almost like anybody that coughs around you excessively at some point, you start covering your nose and your mouth and suspecting that it might be something that, well, except for when COVID was at its height. But now everybody suspects everybody when they cough a little too much. From your standpoint as a professional, do you care to take us through the intricacies of how tuberculosis comes about, the individuals most susceptible to it, and how to ensure that you protect or someone protects themselves from tuberculosis?
Okay, so we may already know, tuberculosis is caused by a germ caused by the Mycobacterium tuberculosis, which is transmitted which is by airborne route through the air, where an individual with untreated tuberculosis coughs, sneezes, or even sings, or while talking releases secretions, what we call droplets into the air.
Yeah.
And if other individuals living in the same household with that person are together for some time, upwards of 3 months or more, there is that probability that others can inhale that germ, and the possibility of coming down with tuberculosis is there, but not in all cases, because there is the factor of the strong immune system. Where the immune system is strong, in some instances the immune system can fight the germ, the TB germ.
Yeah.
So it's people easily come down with tuberculosis when the immune system becomes suppressed as a result of conditions like HIV, AIDS, diabetes, people on immunosuppressive medications,
Yeah.
or people on prolonged use of steroids like medicines like prednisolone and some other, even anti-cancer medications. Once those conditions suppresses the immune system, there is that likelihood that the TB disease, which is being suppressed by the strong immune system, or can manifest in such individuals that have inhaled the TB germ. So there is the concept of TB infection versus TB disease. The infection means that the individual has inhaled the TB germ, but he has not manifested symptoms of signs of tuberculosis, what we call TB infection. And it happens that people can be infected, have TB infection, but because the immune system is strong, they go about their normal business. They are not even able to transmit, because they are not coming down with symptoms and signs of tuberculosis.
So it's just they're in their system but inactive.
Inactive, more like, because they are not presenting with symptoms and signs, because the immune system is able to fight the germ and contain it. So the germ is there, no symptoms and signs, but where the immune system is suppressed by some of these other conditions I mentioned, there is that possibility that the organisms begin to, proliferate within the system, outsmarts the immune system. Such individuals start developing symptoms, signs of tuberculosis that are easily recognizable. Number one of it is cough. When an individual is lasting for 2 weeks, coughing for 2 weeks or more. A fever is also one of the cardinal symptoms of tuberculosis. Fever lasting 2 weeks or more.
Yeah.
Then, of course, weight loss.
Unexplained weight loss.
Unexplained, not intentional, is also one of the cardinal symptoms. Then night sweats, especially for adults, where the individual sweats excessively, profusely at night, what we call drenching night sweat, as if they poured a bucket of water on that individual. Meanwhile, others in similar household are not experiencing that same kind of sweating at night. So these are the cardinal symptoms of TB in adults. Then, of course, one other important factor in considering TB is in an individual, if he's in contact with someone that is being treated or that has been diagnosed for tuberculosis, there is a high chance that anyone living in the same household with someone with tuberculosis may have contacted the germ, and such individuals needs to be screened for tuberculosis. And where they are found to have active tuberculosis, which is the TB disease I talked about, they need to get prompt treatment. Where they do not have active tuberculosis, they may be eligible to receive what we call preventive treatment for tuberculosis. So there is the treatment for active TB disease, which is the conventional one that we know. There is also treatment for what we call preventive treatment. That is treating the inactive form even before it manifests.
Well, doctor, thank you for brilliantly outlining the cardinal symptoms to look out for in identifying tuberculosis. I also see the hat you're wearing, and I'm aware that the Nigerian National Tuberculosis, Borreliosis Ulcer and Leprosy Control Program has strategic plans much like this to heighten TB awareness. Can you take us through some of its activities in the last year in the Check Out More campaign and also in integrating NYSC CDS in contact tracing?
Okay, so thank you. So we, like you may already know, we have a national strategic plan for tuberculosis spanning 2021 to 2026 that is aligned with the new strategic blueprint of the Nigerian health sector, talking about the Nigerian health sector investment renewal initiative that will be spanning like 2023 to 2026.
Yeah.
Remember, there are 4 pillars within that strategic blueprint, and our TB National Strategic Plan is aligned with that health sector blueprint. The overall goal of that NSP is to accelerate efforts at ending the TB epidemics in Nigeria by providing high-quality, patient-centered and community-owned TB services for all Nigerians, irrespective of where they live, their age, their geographical location, their religion, and other factors. So what this strategic plan is underpinning is the fact that we want to ensure universal health coverage as it relates to TB services. And because of that, one key priority is to ensure that we're able to take TB services to all health facilities in Nigeria, whether tertiary, secondary, or primary healthcare facilities. And so far, as at to date, we've been able to take TB services to about 23,000 facilities in the country, and we hope that within the next 2 months, we'll be able to get up to 25,000 facilities in Nigeria offering TB services. That is both public and private. We are not leaving out the private sector behind, because the private sector is one key entity that we are focusing on in relation to TB control. So private, public, we want to reach all over 40,000 health facilities in Nigeria, and with the help of our partners and other stakeholders, we are gradually getting there. The second priority for us is to ensure community-based services for TB. We are currently covering all 36 states and the FCT using community-based organization to go to communities to do outreaches as well as house-to-house case finding, coupled with awareness creation in the communities, because it's been found that just 1 out of every 4 Nigerians have correct, non-stigmatizing beliefs and perceptions about TB. So what does that tell us? Awareness about TB is low. So the community-based organizations are also helping us to create awareness, dispel stigma, discrimination, myths and superstitions that are fueling the TB epidemics. That's another strategy we're also leveraging on, coupled with the community-based interventions, is we are leveraging digital health solutions.
Yeah.
At the moment, we have over about 400 portable digital x-rays that are being distributed to communities and facilities across the country. No states and even the FCT is not left out. These equipment will be used to ensure we're able to provide services to people in the communities, especially in underserved communities. These portable digital x-rays are for TB screening. they will facilitate prompt screening and diagnosis
Now,
of TB.
doctor, before you carry on, this campaigns that you're talking about, across both rural and urban areas, and both in the private sector, the within the government, and all of that. Does it also include community sensitization? Because it's one thing to, go there and ensure that people get treated, they get proper medication, and all of that. How about sensitization aimed at prevention? Is that also part of the package?
Yes, yes, it is. Like I mentioned, the community-based organization, they don't just do screening, they also do sensitization, because without even sensitizing the people, they will not understand why they should come and screen. So there is sensitization that is coupled even before the screening, and the religious leader, the traditional rulers, religious leaders, all opinion leaders in the communities are carried along. They are part of the process, and because of that, people see the need to come out and be screened for TB. We're also trying to
You're
see
talking about the mobile
portable digital
X-ray,
X-ray is the key tool that we are really using to enhance TB screening across the country. Then we're also looking at improving social protection packages, because it's been found that Nigerians suffer from catastrophic cost, which is serious financial hardship as a result of TB treatment. And from the survey we did in the year 2017, about 71% of our people that accessed TB services suffered financial hardship, and about 23% of them said they sold their properties. So we're working on ensuring we are able to provide health insurance to TB patients. We are piloting with like 5 states: Lagos, Gombe, Anambra, Kwara, and Ebonyi states. And we are hoping that with the results of the scale up of that pilot, we'll be able to scale up to other states. Then, talking about the NYSC intervention you talked about, the NYSC CDS is also one avenue we're using to sensitize people in the communities. Youth corpers go to every community across the country, and is a veritable mechanism to use youth corpers to help promote TB sensitization, especially. So we have, you were part of that process. We have engaged the NYSC scheme to ensure that as youth corpers come into camp, they are well oriented, so that when they go for their to their places of primary assignments, they work with the local government supervisors and other TB stakeholders at the LGA and community level to ensure continuous sensitization, as well as also support referral of those with symptoms and signs of tuberculosis to health facilities for them to be screened. So the NYSC collaboration is one intervention that we are really pushing, and we think that will also help to really improve sensitization.
How about religious worship places like mosques, churches, and all of that? Are they also viable means of this sensitization, considering the fact that people would always listen to their religious leaders, and I believe that in some cases, some mosques or even churches will be able to allow for an allotted time slot for your team to also talk to the people on such issues.
Yes, we do that. As part of the World TB Day event, we go to churches. We also go to mosque to sensitize our leaders. And this happens not just in Abuja. It happens across all 36 states and the Federal Capital Territory. One of the state TB program managers over yesterday sent me a flyer of one of the states, and it was boldly written that all the healthcare workers, especially the local government supervisors, the state team members, and even those providing TB services in health facilities, should go to religious homes to ensure that they sensitize, because people listen more to their religious leaders, especially when the religious leader says, let's listen to these people from the TB control program. I'm sure they normally listen, and that is one key strategy for us. We're doing that across all 36 states and the Federal Capital Territory.
Now, we all know that there's the core burden of HIV and TB. Let's discuss the role of investments in TB diagnosis, prevention, and particularly treatment in line of this withdrawal of US aid. We also hear that the government is taking proactive steps to dedicate over 700 billion naira to this. But I saw a statement from NEP1 warning that there are challenges with medication shortages currently in Nigeria. Let's get your thoughts on this.
Okay, thank you. Like you said, the recent US policy is something the government is responding to very seriously. I can tell you that there is currently an ATM technical working group, AIDS, TB, and malaria technical working group, that is meeting on a regular basis. They meet almost twice weekly to deliberate on how the government can step in, both in the short, medium, and long-term
measures.
And I can assure you that that committee that was mandated by the coordinating Minister of Health and Social Welfare to ensure that there is no gap in relation to that recent policy is working very hard. And for TB, at the moment, we do not have any issues with commodities for TB. We do not have problems. We have medicines for tuberculosis.
But in terms of medication compliance, we hear that most patients, owing to the cumbersome nature of medication, always have this tendency to fault on compliance. Are there any efforts to check compliance with medication?
Well, we're improving that with counseling, because we know that medication compliance is more like it's human behavior. We as humans, we differ with the way we respond to medications, or how we adhere to medication intake. So, but what we're doing is to we're training and retraining our healthcare workers to try and ensure there is regular health education at every visit where they meet the patients. They should provide health education on the importance of ensuring that they complete their medications. The problem we normally have is that once people start their medications, because the medicines are very effective, within 3 weeks or thereabout, they feel better, and they feel why do I need to continue these medicines for 6 months?
But let's clear off some anomalies here, or some perceptions. Is TB curable?
Thank you, my brother. TB is curable.
Okay.
With proper intake, good compliance with the medications for the entire duration.
What is the duration?
Okay, conventionally it's 6 months for the drug susceptible tuberculosis. 6 months, or even for the drug resistant tuberculosis that used to be up to 18 months, has now been reduced to like 6 months. So yes, and the good news too is that the medications are all oral medications. There are no more injectables that people normally get scared of. So 6 months of complete treatment, the individual is cured and can go about his normal business.
Dr. Ochuko, you have just brilliantly shed light on this, and it appears that it's not really something to be too scared of. However, for a disease that can be cured in totality within 6 months, it's surprising to learn that an estimated 15 Nigerians die each hour due to tuberculosis, an equivalent of about 347 deaths daily and 10,417 deaths monthly. Why is this figure still high
For Nigeria?
in Nigeria?
Okay, well, let me. I wouldn't know the source for your statistics.
It's a stats from KNCV Nigeria.
Okay,
now, of course, it's a health based organization that deals with statistics and all of that for diseases like tuberculosis.
Okay. So from the 2024 WHO Global Tuberculosis Report,
Yeah.
which is the most updated report, a recent report for WHO.
Okay.
It's been stated that one Nigerian comes down with tuberculosis every minute, and that translated to 499,000 Nigerians with tuberculosis for the year 2023, and 71,000 Nigerians died from tuberculosis in the year 2023. So that's translated, that's like 8 Nigerians every hour dying from tuberculosis, as that's the year 20.
So that's a lesser number as opposed to the 15 persons per hour.
Yes.
Okay.
So yes, that 15 persons per hour is possible. It must have been the statistics for previous years, where maybe way back 2019, yeah. 2020, because of the progress we've made in terms of the number of persons we are placing on treatment, the mortality is gradually going down. So it's not as bad as it used to be, but that's not to say that 71,000 Nigerians dying from TB is something we are happy about. And that's the reason why we're stepping up efforts, and we are trying to see how we can get all sectors to contribute their quota to TB response in Nigeria. The coordinating Minister of Health and Social Welfare will be launching what we call the multi-sectorial action framework, multi-sectorial accountability framework for TB, that will ensure all relevant sectors, education, information, agric, the humanitarian sector, the justice sector, to contribute their quota, because we recognize that TB is not just a medical disease but also a social disease. And that's also, if you remember the theme of this year's World TB Day, it says yes, we can end TB. Commit, invest, and deliver. And our own slogan as a country is we fit do am. And in our local parlance, you know what that means. So we're ensuring, because we recognize that fact that the TB program or the Federal Ministry of Health and Social Welfare alone cannot do the job of TB eradication. Every sector that is needed to contribute its quota would be encouraged to do so, because we know that together, if they said, how do they say? They say 2 more heads are better than just one trying to struggle and
so it's safe to say together we fit do am.
Together with thank you.
Well, Nigeria's sub-theme for the World Tuberculosis Day, we feed Duam. Yes, together we can end TB. Dr. Urhioke Ochuko, the Deputy Director of the National Tuberculosis, Brulee, Ulcer and Leprosy Control Program of the Federal Ministry of Health and Social Welfare, is commemorating the day on ADBN television. We'll take a quick commercial break, and when we return, we'll delve more into other aspects of the World commemoration. Stay with us.
Heartfelt congratulations to Your Excellency, Dr. Mrs. Onoma Ekaite Godswill-Akpabio, on the award of Doctor of Philosophy honoris causa in Education Management from the University of Calabar. This honor recognizes your remarkable leadership, dedication to service, and philanthropic contributions. As the founder of the prestigious St. John Paul Group of Schools, you have revolutionized education in Nigeria. We celebrate your achievements and thank the University of Calabar for acknowledging your sterling qualities. Keep the flag flying higher, dear sister. With love and admiration from Chiedu, Chiazo, Dubem, Akwezu, Pius, Nkem, Onebuike, Nkiru, Ike, and Ekene.
Well, Nigeria joins the world to commemorate the World TB Day 2025. There have been a number of activities lined up for this commemoration. There was a walkathon dedicating over 150,000 steps in a statement to ending tuberculosis. There would also be free screenings across primary health centers. But better still, we still have the Deputy Director of the National Tuberculosis, Brulee Ulcer and Leprosy Control Program, Dr. Ochuko, in our studios. Well, Doctor, before the break, you were talking about the theme for this year's commemoration. We'd also look at some strategic activities lined up on the calendar for Nigeria in the FCT and across 36 states to mark the World Tuberculosis Day.
Okay, thank you for that. Like we normally do, if you remember, it's called the World TB Day, but in Nigeria, it's more like a World TB Week. And we normally line up a number of activities.
Yeah.
The list for this year is long. I cannot reel out all the activities at a go, but I will just go with the key ones. Last week, Tuesday, the 19th of March, we did the pre-World TB Day press conference at the Abuja Continental Hotel, where we sensitized the press on how far we've gone with our TB response, the gaps that are still remaining, and the need for the press to really do, further strengthen their contribution to
in form of interviews like this, and also other means of advocacy as well.
Yes, and if you recall vividly, if you were at that press conference, you challenged us, and we also challenged you that it should be a two-way thing. We can call you, and you can also call us, and we are happy about this kind of conversations we are having this morning. That was the first activity that we started in earnest, and there are series of webinars. There was one that was conducted by the Nigerian Society for Pediatric Infectious Diseases, which is a society under the Pediatric Association of Nigeria, on 20th of March. That was on Wednesday, and it's to sensitize pediatricians and other clinicians as it relates to the burden and impact of tuberculosis in children. On Thursday, I think that was on Thursday, there was on Friday there was another webinar by an association that talks about improving TB care amongst vulnerable populations, indigenous communities, and hard to reach communities. That was on Friday, and that webinar was also quite impactful. Just 2 days ago on Saturday, we did the road walk. I didn't really see you guys at the road walk. Did you had other social engagements?
Well, that might have been the case.
Because we expected you guys to be there. There was a road walk, a quite interesting one from Wuse Market down to Taco Market, where we really sensitized,
and we featured it in our bulletin, just to add.
Oh, that's great. We did sensitization. The market people came out to sensitize them. That was on Saturday. As we speak, there is a community outreach that is going on at Soka community on TB, and Our Excellency Senator Oluremi Tinubu, the wife, First Lady, will be there. If you recall, she's the global and national Stop TB champion, and in fact, she's been a strong pillar for TB control in Nigeria. That community outreach is currently ongoing. Then the press briefing, ministerial press briefing, and the launch of our multi-sectorial accountability framework for TB that will encourage other sectors to contribute their quota will be done tomorrow at the Abuja Continental Hotel. So these are the activities at the federal level, but these same activities are replicated across all 36 states and the Federal Capital Territory. There are other activities, but these are the key ones that I think we all need to remember. And I'm sure that if you're not so busy, by finishing from here, we'll go together for the community outreach at Soka. Then I'm also inviting you for the ministerial press briefing tomorrow.
Well, Doc, in line with the commemoration of this day, have you started receiving any form of support or, commitments from donor organizations, both locally or internationally, in line with ensuring that the fight against tuberculosis is beefed up and fought to the latter?
Okay, yes, we've the TB program is one program that has very strong partnership, not just within the country but also internationally. As you know, major funders for TB control in Nigeria are the government of Nigeria, the Global Fund to fight TB, AIDS, and malaria, then the United States government. We also have
Which has now withdrawn, you said?
not completely.
Okay.
Not completely. Not completely.
Please break that down a little bit for us, because the general notion is that Donald Trump came into power, decided to withdraw all aids to most countries, including Nigeria, via USAID.
Okay, so the withdrawal is not 100%.
Okay.
Even though the details are not as still sketchy as of now, we expect as the days go by, we expect more information regarding what they'll still be supporting. I think they are still supporting. It's not a total shutdown.
Okay.
That I can assure you. So like I said before, we also have other donors and technical partners. The World Health Organization is there. We have other organizations, implementing partners that are drawing funding from these major donors. We have the Institute of Human Virology Nigeria. We have the Tuberculosis TB Foundation, and a number of other partners that are supporting us. So recently, we are even looking at getting the private sector, where the coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, is seriously working to see that as measures to improve domestic funding for tuberculosis, the private sector, the private corporate organizations, they contribute their own quota. And there was a recent summit last year in Lagos where the government committed about $25 million and asked the private sector to also match that funding.
Are we talking about the Lagos state government or the federal government?
No, we're talking about the private sector. You're talking about the private banks, some of these.
They had collectively done this donation.
No, they're working on it, but there is good progress, because the deal was that the government is putting down about $25 million.
Yeah.
Then the private sector were also encouraged to,
as a means of their corporate social responsibility,
to contribute theirs, and that is going on very well. Is one means that we're also pursuing to see how we show up our domestic funding for TB. So these are the partners that are supporting TB control in Nigeria, and it's not, the support we get is not different for the World TB Day. It's the same planning and all that. The World TB Day fits into the annual plan, then the quarterly plans for the government and the partners. So that's how we've been working. But I can assure you that we've had a robust partnership with the various stakeholders, and that's the reason for the good progress that we've made.
Now, Doc, you've hold on a bit.
Okay.
You've spoke so glowingly about the Institute of Human Virology over time in repositioning Nigeria's approach to its TB response. From a layman's perspective, how important is the Institute of Human Virology in repositioning Nigeria's TB response?
Okay, so currently, I would say that the Institute of Human Virology is one of the recipients of the Global Fund grants, and they're actually the primary the non-prime organization that is driving TB control within the private sector. They're also helping us to drive the community-based interventions I talked about. Then their third key mandate is promoting TB HIV integration, as in midwifing TB HIV integration between the TB and the HIV program under the Global Fund grants. So yes, these are their core mandates, and they are quite very supportive of the national program in this, not just the national and state programs in this regard.
Now, some of the misconceptions, because we heard your earlier background on how TB can be transmitted, takes from the sputum of an infected person. We also hear that persons can actually live with persons with TB without necessarily coming down with TB. There's also been the myths of not sharing eating utensils as against being able to share eating utensils. Could you help us clear this line between some of these myths and misconceptions about TB?
Okay, so like I said before, TB is transmitted by the airborne route when an untreated individual with TB coughs, sneezes, talks, or even sings. It releases what we call secretions, what we call the droplet infection,
Yeah.
that someone living in close contact with that individual, mostly people living in the same households for extended periods, they can inhale the TB germ. That is the primary route of TB transmission or TB spread. TB is not caused by spiritual forces. Is not transmitted from genetically from mother to or rather through the gene, so to say. Is not also transmitted by sharing utensils or by the sin that someone committed and all that. I think these are all myths and superstitions that people should not encourage, because one key thing that we've seen that is fueling the TB epidemic is stigma and discrimination. And like we said, TB anywhere is TB everywhere. We all need to put heads together,
Yeah.
and ensure that we spread the correct messages about TB, so that people can willingly come out when where they have symptoms or signs of TB to be tested and promptly treated for TB, because we know that the treatment of tuberculosis is free across health facilities in Nigeria.
Well,
And we also, sorry, before you come
All right.
in, we also have a toll-free line, helpline, that people can call and to access services for TB. People can dial 3340. Let me repeat again, 3340, or they can send SMS to star 3340 hash. These are the numbers people can reach out to for them to get, maybe if they are not sure where to get TB services, they can call these numbers.
Well, doctor, it's quite good that you had mentioned something around, the World Tuberculosis Day being celebrated globally, but in Nigeria it appears to be an entire week of, advocacy, campaign, and all of that. However, I believe that more could be done, because in India, it says that as part of its commitment in eliminating tuberculosis in the country, the government of India has recently launched a 100-day intensified campaign on TB elimination, which started on 7th December 2024. Now, this is India with a very large population. Now, of course, we all know that I don't want to go into the details of how much they pay attention to health over there and all, but the fact that they have carved out 100 whole days of intensified campaign says a lot about how much more work we need to do as a country in this, in charting this course and fight against tuberculosis. Do you subscribe to this line of thought?
I agree with you. I'm sure we'll get there, but I can assure you that we were doing a lot. Outside this World TB Day that we've converted to a week, is even getting to like 2 weeks, because if you remember, we started
On the
last
19th,
week,
yeah.
and for the rest of this week, there will still be activities. We also have other campaigns that we do. If you recall, there's the National Childhood Tuberculosis Week.
The
That
testing
comes
week 20 for
dedicated
children, yeah.
for children.
22nd to 26th of May.
Week of Children's Day. We do that. Then there's the August National Testing Week, the first week of August. So by the time you combine all these multiple campaigns that we're talking about, it may not be up to 100 days.
Yeah.
But it may
Well,
be.
but it's
may be a month long.
So I agree with you that we're making good progress.
Yeah.
We're running with we're taking after countries like India, and
Like
to
India.
see that the Indians can be very ambitious, and we're also as ambitious, because we've been told that from the modeling studies that that was done to model what the resources that is needed to eradicate TB from Nigeria, we've been told that we really need to be ambitious. And I agree with you that the Indians are quite ambitious, and we are also ambitious. We will get there. 400 portable digital X-rays across communities and facilities in the country is quite
huge
an
investment.
Huge investment.
You are doing your beat, Dr. Ochuko. Wonderful, wonderful work you're doing. And I must commend you and your team, and in fact the entire Ministry of Health, for this strong advocacy. However, beyond the health professionals like yourself, to the ordinary Nigerians who either suffer from tuberculosis or are at the risk of contracting tuberculosis, what is the role of the populace in ensuring that we sort of help or support the efforts that you're already doing to the general public now?
Yes, I think the general public should they should not stigmatize or discriminate against people with tuberculosis.
Yeah.
Because TB is a curable disease, and is not caused by witchcraft or whatever sin that individual must have committed. Just like every other disease that is transmitted by germ.
Yeah.
People should be encouraged to come out and screen for tuberculosis. And when they are found to have tuberculosis, Nigerians and communities should support them to complete their treatment.
Yeah.
Even their employers should not send people away from work because they have tuberculosis. That is a dangerous stigma. That is a dangerous trend that is making people to be scared of coming out. Stigmatization. So let's be our brother's keeper. If you know anyone that is coughing for 2 weeks or more, having fever for 2 weeks or more, unintentional weight loss or night sweats, encourage such individuals to go for the free TB test. And when they are found to have TB and they are receiving medicines for TB, they should be supported by both their friends, their family members, and colleagues in the workplace.
Yeah.
If we're able to do that, it will go a long way in helping to combat the TB scourge.
Now let's talk about the burden of tuberculosis in children. We've talked about the demographics of people who are at a risk of TB, and TB has often at times been associated as a disease of poor sanitation, and particularly for persons that are low income. But when we talk about TB in children now, it becomes even more worrying about the need for contact tracing and to be able to take this advocacy to families with such a burden?
Okay, so sorry, I forgot. I didn't mention earlier that TB children are also at risk. Children and the elderly are also at risk of tuberculosis because for children their immune system is not as developed as that of adults. Why for the elderly? Because of aging, the immune system is
Weakened.
weakened. So children and the elderly population are two demographics or subpopulations that are prone to tuberculosis.
Yeah.
So especially children under 5 years of age. So in terms of the burden of tuberculosis in children, for the year 2023, we had an estimated 59,000 Nigerians with tuberculosis. Nigerian children with tuberculosis. But the good news is that we're able to provide treatment for about 43,000 of them. If we do 43, that's like should be close to
More than 95%.
no 43 over 59,000. I may not be able to get the
The
mathematics
exact
right now.
percentage.
But still we had about 22,000 of the children that we could not reach or place on treatment. So yes, if we talk about universal health coverage, every child with tuberculosis should be diagnosed and placed on treatment. So 22,000 for us is a huge figure. But when you compare where we're coming from like 2018, where we notified barely 8,300 children, and for 2024, 43,000, you can see that we've made good progress, all with the support of our esteemed partners and all the recent innovations that I've mentioned, the testing campaigns, the equipment we are deploying, as well as the awareness that we are scaling up on the burden and impact of tuberculosis in Nigeria. So yes, just as we've had good progress with finding TB in adults, we've also made good progress for children, but we've not gotten to the last mile, and because of that, we still think there's more work to be done to be able to ensure that Nigerian children are free from the TB TB scourge.
Dr. Ochuko, we have just about a minute or two to wrap up the conversation. I know you had mentioned it earlier, but just for clarity's sake, we would want you to just run us through the list of activities for the remainder of the number of days that you and your team will be commemorating, the World Tuberculosis Day or week in this instance now.
Okay, so the remaining activities, I think I've talked about the one for today, where the First Lady, Her Excellency Senator Oluremi Tinubu, will be physically present. The community outreach at Soka community, that is one key event for us. Then, of course, the ministerial press briefing that will be coming up tomorrow. And we're also hoping that our multi-sectorial accountability framework for TB, which is our #1 policy document to encourage all stakeholders to contribute their quota to TB eradication, to our TB eradication effort. We hope that document will be launched tomorrow. And these are the key remaining activities, apart from the community sensitizations that will be going on across all LGAs and even facilities across the country.
All right, Dr. Ochuko, we must thank you so much. It's been wonderful having this conversation. Hopefully, we'll have you here again in the studio with better news as to the statistics of tuberculosis in the country.
I assure you that will happen.
And we wish you the best of luck in your activities.
Thank you. And I'm so excited to be here. Thank you for having me.
Thank you.